All right. Hi, everybody. Welcome back to the Get Healthy Tampa Bay podcast. I'm your host, Dr. Kerry Reller, and today we have an awesome guest, Abby Clapper. Welcome to the podcast.
Thank you so much. I'm excited to be here.
Yes, and I know you're going to tell us all about your podcast as well, but why don't you tell us about who you are and what you do?
Yeah, absolutely. So, I am a personal trainer full time. I own my own business right now. I graduated with my bachelor's in kinesiology from the University of Wisconsin-Oshkosh back in 2017. I'm also a certified exercise physiologist through the American College of Sports Medicine, a certified yoga instructor, and a group exercise instructor. So, I do a little bit of it all, but I've been doing personal training the most for the past 8 years and absolutely love it.
That's awesome. I like how you have all these different, kind of hats that you're wearing as well. And tell us the name of your practice because I think that is one of my most favorite things after, looking up a little bit of you on the internet. I love
Oh,
the name
thank
of
you
your
so
practice.
much. Yeah, my business is Endorfin Wellness, but Endorphin is spelled Endorfin. So it relates a little bit better to Florida while still
Yeah.
hitting those endorphins.
Yes, I love it. Yeah, we're obviously in, the Tampa Bay area and water is a big deal. So it's, fins. I love it. I love it. I love the name of it. But anyway, so you are definitely a passionate person about health, wellness, fitness and lifestyle. And you have, so much to offer. And before we were recording, we were talking about how you have some little niches within that community. And so I guess let me just start with, a good question here, which are there parts of mainstream fitness culture that feel especially difficult to access or to fit for someone who is neurodivergent? So we were talking before about the podcast about this kind of different community that you've been exposed to.
Yeah, absolutely. The majority of my clients are neurodivergent, which I love. I kind of fell into it. And for those who are unfamiliar with neurodivergence, it's just, when someone's brain works a little bit differently. So it can range from ADHD, autism, OCD, some different mental health disorders, different thing, a wide range. Everyone's brain is like a thumbprint. It's all different. So everyone, it reacts differently to different things. So, anyways, I kind of fell into this niche. I found some neurodivergent clients, and it's really taught me a lot about different needs within the fitness industry that a lot of times, like in school, I didn't learn about, how to handle, something outside of the general population. So there are a lot of things within like mainstream fitness that don't relate well to people whose brains work a little bit differently, whether it's going to a fitness center, being overstimulated by all of the different equipment, the loud music, the bright lights, the loud fans. Gyms can be really difficult, a really difficult place. So what I do is I'll either go to people's homes and do their sessions at their homes, or I will do a virtual program with them. So I'll give them a workout that they can do at home from the comfort of their own space at a time that works well with their schedules.
hmm Yeah, I'm so glad you defined it because I think it's a word that's thrown out, around neurodivergence. Like, what does that really mean? But yeah, like you were saying, people's, brain operates a little bit differently. I mean, everybody is unique in their own way, obviously. And being able to cater toward what is going to work best for your client or patient is very important in any industry, right? So I think that's amazing that your ability to adapt everything. So how do you, besides, the environment, how else do you adapt like workouts or communication styles for your clients' needs?
Yeah, so you kind of have to learn how to do it with the client. So, like we're saying, every client is different. So some clients, react better to verbal cues. Some need more demonstration. Some need more hands-on, just really depending on what the exercise is. So it's figuring out what works best for each person. And this can go outside of the neurodivergent community as well. Everyone learns differently too. I spent the majority of my career was in the corporate wellness space. So I had a lot of different people because there's a variety of different people that work in offices and then they all come together. And so everyone is individual and unique and just finding what works best for each person. So yeah, just finding the ways that they resonate with the most or maybe a combination of each. I'm actually doing a continuing education course right now on autism and exercise. And so it's giving a lot of really good resources for, not just people with autism, but, people all over the neurodivergent community or with clients in general.
hmm I think, and that's like a tricky part with autism as well, because they are with different therapies, like applied behavior therapy for the kids and stuff. I don't know how much they focus on like physical activity and things like that.
Hmm.
So I think that's a really good component to try to bring into there. And yeah, I think that's fantastic. There's even continuing education on these kind of things because I would have never really thought so. So
Yeah.
that's cool. So in this kind of community or anything like that, do you find that there's certain types of movement or training that's a little bit more accessible or beneficial for
Yeah.
neurodivergent patients?
Yeah, I would say so. So, we start with the basics. So if someone doesn't have experience with exercise, so like you said, especially with kids, it's not necessarily, I'm hoping that's changing now, especially now that we're learning more about it, that kids will be able to start, finding that physical activity sooner. But a lot of times when, you have someone who is neurodivergent, it comes, your body awareness sometimes just isn't, it's just not well known to yourself. So starting with light weights, helping someone figure out how to move their bodies properly. I know I had mentioned before we started, hypermobility can also play a part for some different neurodivergent clients as well. So making sure that my clients know how to stabilize their bodies and move their muscles properly is huge to me. So, we're starting out using really light weights and just going through everyday functional movements, squats, hinges, pulls, pushes, things like that is, something that's really important. It's going to help them in their day to day. But then from there, once those base movements are established, then we can move into more of the accessory things, bicep curls, tricep kickbacks. But we have the foundations built first, which I think is really important.
How do you, well, let's see. So how do you basically understand that they need that extra step? And are some of these people or patients, clients, whatever, I don't know what to call them, are they like new to exercise? I guess that's my real question. Like, are they usually completely new? And like you said, they have to learn how to do the movement at the basic, in the basic level.
Yeah, I would say it's probably 50-50. Some people have
Okay.
exercised in the past. Now, in my generation, a lot of us grew up hearing that cardio was the only way to go. And so strength training just naturally for a lot of people wasn't something that was taught. So there were, I do have some clients who did sports previously, and so they had been through different exercise programs, but our bodies are different now. A lot of my clients are in their 30s and 40s, and so our bodies move a lot different now than they did when we were in, our teenage and 20s and college years. So, so yeah, I would say that, it really just kind of depends. I really do start similarly with each group, whether they have exercised or haven't. We do the basic movements. And this might sound funny for like people who usually go to the gym and who are familiar with it, but I start a lot of people on the floor. So like if we do a chest press, we don't do it off of a bench or a raised surface because that can allow for the arms to do, crazy things, go farther past what they should be. And it really teaches like that proper movement. And by doing it on the floor, you have a little bit more stability. You're also a little bit more comfortable with your range of motion. So that's just something that I personally take into consideration when I'm working with someone. I'm not sure that everyone would, but that's just something that I do.
No, I mean, I think that makes a lot of sense. I didn't have a bench until Christmas. So that's new for me. So I was always doing things on the floor. And, my husband and I, we do like our workout routines mostly at home. So I felt uncomfortable when I moved to the bench. And it was like
Mhm.
a whole new learning process for me again. And
Yeah.
see why you would start with the floor because I definitely felt safer. Like all of a sudden doing chest press on the bench, it was like, I'm not doing as much weight because I'm nervous, and I'm not sure where things are. So
Yeah,
I can relate to that for sure.
absolutely.
Yeah. I was gonna say, so have you noticed any improvement or have your clients like said that there's improvement in their ADHD or any other like mental health symptoms as they, continue to work with you and work out more?
Oh, that's a really interesting question. I don't know that their diagnosis or symptoms have necessarily changed. However, being able to have what word am I looking for? Having like an accountable, consistent routine has been the game changer because, a lot of times, specifically with ADHD, finding that routine can be sometimes difficult because there's a lot of different things that you want to focus on and finding the things that you want to use your executive function for, they can vary from day to day with autism as well. So, but by having someone keeping them accountable, keeping them consistent over, 1 year, 2 years, they're definitely seeing the physical changes that they hadn't seen from maybe an on again, off again routine that they've tried in the past. I will say with a couple of my clients, their proprioception, their self-awareness of their bodies has improved. They are gaining strength, better mobility. They're able to maybe do things that they hadn't been able to do in the past. Like let's say if someone has like dysautonomia, those symptoms aren't necessarily better, but they're able to better manage them or they're not hurting themselves when they're exercising because now they're lifting weights properly and it won't throw their joints, their muscles into, a flare up that they might have experienced in the past.
hmm I think you mentioned something that's important, like consistency, right? And having that schedule. So I can imagine that someone perhaps with ADHD is getting overstimulated from things and where to go on the internet with workouts. And right, there's a million different choices out there. And working with one person, on a consistent basis with a schedule can definitely be more helpful for any person that has kind of some of those qualities, I think. So that's a really good point there. Do you have any like client wins that you would want to share for anybody who's in this, neurodivergent category?
Oh my gosh. I feel like there are so many wins. I feel like we've had like a lot of really good wins outside. Like, so I focus a lot too on non-scale victories, right? So I focus primarily on weightlifting. I think people should be strong. I think it can help you as you age. We want to maintain muscle as we go. But I do think there's one specifically that I can think of. I have one client who will have like flare-ups, on different days, it kind of depends on how hard she's working or if she's doing something really, really strenuous. But she's been able to go to theme parks with her friends, whereas in the past, maybe she would be having a flare up or she'd be in a lot of pain, and her friends would have to push her in a wheelchair just so that she could still, participate. And lately, which has been awesome, she's, gained enough strength and she's been doing really well. She'll still get flare-ups, but she's been able to go to the theme parks and not need a lot of assistance from her friends, which was a really big win for her and for me. I think that that's amazing. I want my clients to experience things like that. That's not to say that maybe another day she wouldn't need some extra help, but she's just feeling stronger and more capable to do these things. So that's been really exciting.
Yeah, that's an amazing win. I'm going to assume, is this person also like you mentioned before, the hypermobility? Is that person
Mhm.
also kind of have struggling with that as well?
I'm
Like
trying to
what kind of flare up? I didn't know what we were.
Yeah, so endometriosis is one that
Okay.
she has. So she would have endometriosis flare-ups. Endometriosis, like I said, one of my other clients has the dysautonomia, on top of the neurodivergent. So, it's really I give my clients a ton of credit because they are managing so many things, right? So they're managing their physical health, they're managing their mental health, and it's really draining. And, we talked a little bit about executive function. And I don't know if you've ever heard of the spoon theory. It's something that I like to bring up to everybody, but especially in the neurodivergent community, the spoon theory is when, like, let's say you start your day with 20 spoons. It costs you something to do each part of your day. So even just to get out of bed, it might cost you 2 spoons. So now you've only got 18 left. Do you eat breakfast or do you watch TV? They cost different amounts of spoons. Do you brush your teeth or do you take the dog for a walk? Different amounts of spoons. And so by midday, some people could be out of their spoons already, but still have to push through the rest of the day, essentially taking spoons from the next day. So they're always kind of feeling like they're in a deficit. So that's something that's really interesting that I like to think about when it comes to people who are neurodivergent or have chronic conditions, because, a lot of times they're really pushing through more than they have available.
I've heard a similar theory, not described the spoons. It's also like kind of something like about a little bit of willpower theory too. I'm not really sure this is exactly parallel to what you're saying, but you only have so many like minutes of willpower within a day, like 15. And some of that could be choosing, walking the dog or whatever. But, I think it's a similar thought that you kind of run out of that. And how do you build that back is a big
Yeah.
question that we all need to learn.
Absolutely. And that
Yeah.
also brings up within the community of, having with neurodivergence and with chronic conditions, allowing rest. A lot of personal trainers will push people, you
Mhm.
want to push people hard. But when you're understanding with these chronic conditions, with neurodivergence, sometimes like with anyone, obviously rest is needed. Rest is a good thing, but catering the workouts just a little bit differently to people, having things that they can do while they're laying on the couch or while they're laying in bed, because it does cost something to get up from those places. And if they still want to be able to do something, a stretching routine can be just as beneficial as, going out and doing a weight routine, depending on what their body can do that day. So it's really interesting. It's very different from working with someone who's not neurodivergent or doesn't have chronic conditions. So the difference is just, it's fascinating.
hmm I would like akin that to like active recovery days, which I think are
Yeah.
also, yeah, kind of very important. And I'm preaching to the choir, aka myself, which I need to make more active recovery days. But yeah, that's definitely an important factor that needs to be incorporated into any, fitness or what exercise routine, whatever you want to call it, is rest. Yeah. We touched on it before. So what are some unique challenges that hypermobility presents when it comes to exercise and strength training?
Oh yeah, hypermobility. A lot of people who are hypermobile sometimes don't know that they're hypermobile until they see, a professional, someone. My massage therapist just told me that he told someone that she was hypermobile the other day, and she was like, "What? I had no idea." But by doing certain tests, you can see. Now, thankfully, people have told me that they're hypermobile. I haven't found
Mhm.
that out on my own, but you have a higher risk of injury often because the joints just aren't moving properly and they can hyperextend, leading to, obviously pulling muscles, tearing tendons, ligaments, things like that. So it's being really careful and just like a little bit more cautious. Now, my hypermobile client can still lift pretty heavy weights now and can do a lot of things, but just having a little bit more caution around those things, doing frequent check-ins, how's that joint, how are the muscles around that joint feeling, and making sure that they're moving in the proper range of motion. So if we're doing like a shoulder press, if you see those shoulders start to go forward or back, just kind of correcting or finding a different way to do those shoulder presses so that their joints are aligned and finding a better position for it. So there's definitely the challenge, I would say, of injury and also maybe not feeling an exercise where like the general population without hypermobility would feel it. So for example, if we're doing, let's say, like a bent over row, like a single arm bent over row, maybe feeling it more in like their tricep or their shoulder instead of in their back, that just means that we need to kind of adjust, do as a personal trainer, have better cueing, roll the shoulder down and back, put that joint into the place where it needs to be, and then slowly moving through the motion, maybe with just a little bit more cueing to make sure that it's going into the right spot. So it does bring its own set of challenges, but there are ways, definitely ways to overcome them.
Would you say patient or clients who have something like Ehlers-Danlos or even fibromyalgia would fall under this category?
Absolutely. Yes. I actually
Mhm.
recently learned what was the first one you said? Ehlers.
Ehlers-Danlos? Yeah.
Yes, I think is a type of hypermobility. And I
Yeah.
just found out one of the members in a class that I teach has it. And I was like, that's fascinating. Would have been good to know, before taking this class. But yeah, that definitely falls under it. Fibromyalgia, I think, has a little bit more to do with like inflammation too. So there's just a little bit more pain in the joints, I think, as opposed to hypermobility, depending on what happens. But definitely I would take a similar approach to that as well.
Mhm. It's interesting. You mentioned like tendons and risk of rupture and things like that. Well, pregnancy is a state of, I don't want to
Yeah.
say hypermobility, but a state of, risk for that as well, right?
Yeah.
Would you say, I don't know if you work with any pregnant clients, but
I've
I
had a
know there's
couple, yeah.
hmm
And they definitely get their joints and everything just gets a little bit looser. They get a little bit more flexible. And so that's yeah, absolutely something to take care of which is
yeah.
funny because when I see people, pregnant women who do CrossFit is fascinating to me because I'm like, wow, like that is just so insane to me. Like they're working so hard and doing so much with this baby in their belly. It's just wild.
hmm Yeah, I mean, it's healthy and we still, can say that you can
Yeah.
do these things. I think the only
Mhm.
risk with that is usually, pelvic floor issues later on.
Mhm.
And unfortunately, I think you might get that either way. So I don't really
Right.
see that it's like a thing that you need to stop doing that. But
Yeah.
yeah. So is there anything that you would say is kind of harmful or unhelpful for patients who are hyper immobile?
I don't think that there would be anything harmful as long as, if you're doing a program by yourself, just making sure that you're really in tune with your body or maybe having, someone who maybe a friend or someone who, is within the fitness industry and can maybe check your form and make sure that you're doing okay. I'll always recommend working with a coach or a trainer just because they're really able to kind of help put you in the right position, help, assess what you're feeling and, its importance of, or, where if it's something that's harmful or not harmful. I think it's super beneficial because it really can help stabilize the joints as opposed to just letting them continue to be loosey-goosey. And so, yeah,
Mhm.
I would say strength training would be a benefit for anyone who's hypermobile.
Do you assist anybody with like cardio as well?
Most of my clients do cardio on their own, unless sometimes I'll program it in for them, but it'll be, something similar, either something they can do at home and something that's, well within their means that I know that their joints are able to do. But I
Mhm.
think a lot of times, especially steady state cardio, like, running, ellipticals, things like that have kind of limited motions, especially an elliptical or like a bike, you'll have limited range of motion, which will kind of keep them where they need to be.
Okay. Since we already kind of asked you about client wins, what is maybe a strength building tip that you would give to someone with joint instability?
Oh, I would definitely say to start with lightweight and start stabilizing first. So, when people think about strength training, they think about lifting really heavy weights. They see people throwing around barbells, doing deadlifts and
Mhm.
squats in the gym, but there is absolutely nothing wrong with starting with light weights and teaching your joints how to move correctly. I'm a huge advocate for that because we want to continue to move well as we age. And even if you're not hypermobile and you haven't exercised yet, still starting light and learning how to move your joints through the proper range of motion is so important for continuing to move well as you get older.
Mhm. I would even argue that starting with no weight at all is, kind of
Yeah.
beneficial too.
Hmm.
Like even with like arm exercises, if you really focus on, that mind-body connection, you can get, good, what is the word? Contraction of the muscles and,
Yeah,
start building muscle there. Yeah. And what I
absolutely.
really like that you said is you kind of start people on the floor too, because
Mhm.
not only are we talking about how I, felt safer on the floor, but just because you're talking about life movement and managing throughout the day and everything, you got to be able to get up off the floor, right?
Hmm.
Successfully and be building those muscles and those movements that are, helpful for longevity as well. So that
Exactly.
was really a good idea. What else do you want to share with our listeners today?
Yeah. So I do have on my website, so endorphinwellness.com/free dash resources. I have a workout template. So if you are new to working out, even if you're hypermobile, if you're, dealing with any type of thing, it's a very simple way to start your own workout routine. It's super easy. You can do it at home, you can do it at a gym, but basically it'll give you there's an index of exercises. You can track your food if you want to. You can track, your what weights you're using and just track your other healthy activities. You're like a healthy habit tracker. So it is in a PDF form. If you're interested in looking for a place to start, you're welcome to download that. And all of the exercises are linked to a YouTube video, so you can watch the form videos as well. And then obviously reach out if you have any questions about that.
That sounds like a great resource. Very cool. We can include that in our show notes and everything, right?
Yeah, absolutely.
Okay, cool. So I guess maybe one last question, but what is one mindset shift that you think we all need to make when it comes to health and fitness?
Oh, that it doesn't need to be perfect and that consistency over time is where you're going to see the results. So many people want fast results and want to see it, doing different like fad diets or things like that, but it's a fad for a reason. It doesn't last a long time. And so we want to look at health and wellness as long term instead of short term. So you might have short term aesthetic goals, and that's totally fine. But we could shift that mindset into thinking, okay, well, maybe you want to look good, not just for the wedding that's coming up in 3 months, but you want to look good for the long term, right? You want to continue to look good well past your wedding that's in 3 months. So I think shifting the mindset to more of something long term is a game changer because I mean ultimately like you can do a crash diet for 3 months and mess up your metabolism and maybe see
Mhm.
results but then gain the weight right back as soon as you hop off the diet. But if you really make small sustainable changes over time, you'll see more results and you'll feel better as well.
I think you put way more than one idea in there,
I'm
so
so
it's
sorry.
okay, but I think you overachieved. Those were all really, really great points. And you mentioned your website. Why don't you tell us about where can people find you and tell us a little bit about your podcast?
Yeah, so I'm at Coach Abby Clapper pretty much everywhere: Instagram, Facebook, LinkedIn, TikTok, and YouTube. I try to cover all the bases. And then on whatever mode of social media you're looking at, you can also find my podcast, which is called Talk Your Abs Off. It's a fitness podcast. It focuses on a variety of different health and wellness things. Essentially, I want people to find the one thing that's going to work for them that they can keep doing for a lifetime. So yeah, Talk Your Abs Off on Spotify, Apple Podcasts, YouTube, anywhere you get your podcasts. Yeah, that's about
Awesome.
that. Yeah.
Awesome. Well, thank you so much for coming on the podcast today and teaching us all about neurodivergence and hypermobility and everything that you know about, exercise and fitness. So this was a lot of fun. And everybody, please, thank Abby, and we will tune in next week for next week's episode. Okay.
Thank you so much.